Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for joining us today for the snowstorm edition of our COVID update. In case we didn't have enough challenges in 2020, we decided to add a snowstorm this week. So we'll talk briefly about that and then spend the predominance of our time on the COVID situation. In terms of the storm impacts here in the county, I think thanks to the great work of our collective road crews at the state, county, and local level, we've done a great job being prepared for it, responding to it, and now finishing up clearance operations and public safety operations. Please continue to stay off the roads for the next few hours and ideally through the night if possible. There are still several roads that need attention, and also keeping traffic off of the roads makes it easier for our road crews to finish up that work. So please stay put and safe and warm if you can. And we'll talk a little bit more about the storm here later in the update. But I want to thank all of our road crews that were out throughout the night into the early morning and are still out there doing that work. We appreciate what you're doing. We thank you for that. In terms of the COVID situation, unfortunately, yet again today, don't have much positive news to share in terms of where we're at. It's very clear that the second wave continues to pick up steam and accelerate across Ulster County. We actually set, unfortunately, a new record today for the most number of new positive cases in a single 24-hour period. We had 152 new positives in the last 24 hours. We also crossed another dangerous threshold, exceeding 2,000 total active cases. And if you'll remember, it was just on December 1st that we crossed over the 1,000 threshold. So in just a little over 2 weeks, we've now more than doubled those active cases, and that is concerning and clear indication of community spread of COVID-19 throughout Ulster County. And unfortunately, we have also had in the last 48 hours 3 COVID-19 fatalities among our residents, bringing us to 115 total in the county. I stood this morning with the governor providing both a storm update, but also he shared updates on COVID. Across the state, we're seeing this surge, and it was very clear, and he made clear, that if we do not flatten this curve, there will be significant additional restrictions and possible shutdowns. So it is in all of our interests, not just for public health reasons, but also for economic reasons, that we work collectively to flatten this curve and do everything we can to slow the spread of COVID-19 in the county. In terms of where we're at with the numbers, you can see here total cumulative cases getting dangerously close to 5,000. We have continued to up our testing capacity. We've now tested just under 180,000 residents, 2,742 recovered, and tragically, as I said, we're now at 115 fatalities. Yet another reminder of 3 lives lost, 3 families just devastated, and hundreds of friends and colleagues whose lives are upended, adding to a growing human toll that COVID-19 has taken right here in Ulster County, and unfortunately we're continuing to see those numbers grow. Hospitalizations have held steady since our last update 2 days ago. We're at 24 currently hospitalized in the county, 1 ICU bed utilized, but you can see the trajectory there, which is concerning, of a continued growth in hospitalizations, which we would expect as the total caseload continues to build. We know that some percentage of those folks will require hospital care, unfortunately, and we'll talk about our hospital capacity here in a moment. In terms of active cases, as I mentioned, we're now over 2,000 active cases in the county at 2,044 total active cases. Every day, our public health team, our nurses and staff, are clearing cases, meaning every day we're talking to those folks that are COVID positive, checking in on them, checking their symptoms. If they are through that 14-day period or recovered, we're marking them as recovered. So even with those recoveries continuing to happen, we're seeing the net active case number continue to grow and reaching sort of an exponential level. New positive case rate is also up. In the last 48 hours, we have tested 2,831. We've tested 2,831 and had 216 positive in that 48-hour period. That's a 48-hour average of 7.63%. We had held, as you know, under 1% throughout, after the first wave, really throughout the summer and even into the early fall, and then we've really seen it steeply accelerate with the onset of the second wave. In the last 24 hours, where we had the 152 cases, we're at an 8.5% new infection rate. What does all this mean? And what does all this mean, knowing, by the way, that we do have a light at the end of the tunnel with generally available vaccines coming in the spring? I want to put up a graph that I showed the other week and really hit on this point again. So what you can see here on this graph is really the whole course of the pandemic in Ulster County, from the very first case in March up through now, which is marked by the orange line, and then looking forward into the end of the year, through the winter, and into the spring. And what you'll see is that obviously we had our first wave, which happened through March and into April, May. We did what we needed to do to get that in check. We shared that collective and made that collective sacrifice and took that collective action. We held that through the summer, and now we're well into this second wave, which is accelerating. And we're at this inflection point, and on December 8th, I put this graph up just about 10 days ago and said, look, we're at this inflection point. It's within our hands to decide, are we going to do what's needed to get this under control, or are we going to see it continue to escalate? And the difference in what that means, you can see in those projection arrows. And what those arrows really mean, I know that sometimes it feels distant. Those differences in cases mean how many people go to the hospital, and ultimately those lines represent human lives here in Ulster County of our family members and loved ones, our friends, our neighbors, our colleagues. So the individual decisions that we each make to follow precautions, to limit social gatherings, and to really just hang on through those restrictions through the winter, those will definitively mean the difference in the numbers that we have to report and share of lives lost to this pandemic in through the winter. So once again, I'm urging and really pleading with everyone, every single person in the community, to think about, as you're making those decisions, do I need to wear a mask? Should I get together with family and friends, whether it's for the holidays or just a get together to catch up? Please don't do those things unless absolutely necessary, because if not someone you know and love whose life will be affected, it will be someone else in our county, especially now that we are at a community spread point. So I'm going to continue to try to remind us that we know there's now a finish line in sight, and I know it's been just an absolutely brutal year in 2020, and we've asked so much of each other and of the community to make these sacrifices. But if we can just hang in a little bit longer, it will mean the difference in saving lives. In terms of that hospital capacity and treatment capacity, we remain in a good position here, where we have more than sufficient need should the cases continue to climb. 24 currently hospitalized, 1 in the ICU, as I said. But you can see in those capacity numbers, we have very sufficient or beyond sufficient beyond sufficient capacity for the need from the hospital perspective. Once again, the reminder every time, it gets old to hear it, it gets old to do it, but it works. Continue to please wear masks, maintain social distancing, wash hands, avoid those gatherings, those living room gatherings, those social get-togethers that the more we see in the data, the more we realize they are a major source of transmission. So treat those interactions the same way you would with a stranger at a grocery store or someone who you don't know whether they have been exposed or not. So those are the high points for the COVID update. We continue to get a lot of questions in terms of what restrictions might be coming. I know, through the fall, the governor had rolled out the yellow, orange, and red zones. Those do remain in place. However, they've continued to adjust the criteria based on the latest data and the health advice. So the criteria that had previously existed and been set by the state to move into those has changed and is now much more tied to the hospitalization numbers and the hospital capacity numbers. So we have been getting questions of why aren't we in one of these zones? And the answer to that is because the state has changed those criteria a bit. We continue every day. I'm on the control room call for our Hudson Valley region. We continue to share our view from the ground of the concern that we're seeing on the ground with the rising rates, with our hospital numbers going up. And we're doing everything we can to address that here at our level. And again, asking each of you all and every member of the community to do their part in that as well. I wanted to share a few other updates on the winter storm and our response to the winter storm. Starting about probably 96 hours ago, as we knew the storm was coming, we moved into a concerted preparation and planning mode for that. And our team, from Department of Public Works to our emergency services and so many others, were just absolutely phenomenal in their preparation and their response. We received, depending on where you are in the county, somewhere between 15 and 24 inches. Down at our house in the Gardner area, we were closer to 15. Westward in the county, up in the Catskills, they were approaching 2 feet plus. So for the skiers and outdoor enthusiasts, there's lots of snow up in the Catskills now, building on what was already there. Through that planning and that work, throughout yesterday evening, through the night, and into the early morning, and still today, we've deployed among our county workforce, state transit workers, and our great town DPW crews, dozens of trucks, plows, and crews across the county. Our roads are in pretty good shape. The thruway is in very good shape. Most major roads now are in good shape, but we are still working on the secondary roads and ask folks once again to stay off of those routes unless absolutely necessary. I want to thank the governor this morning. He declared a state of emergency in Ulster County and 17 other counties. That gives us additional flexibility to move resources as needed, to secure funding as needed, to meet that emergency response. The state was also great in providing additional equipment and staff as we requested it, both myself and Mayor Noble. So I want to thank the state team for that. And more than anything, I really want to thank our incredible DPW crew here, our Ulster County team. We were over there yesterday bringing them some hot meals and other delicious snacks from our local restaurants, who were very generous in providing that. I want to thank specifically those DPW workers that were just going through the night in some dangerous conditions, clearing mountain passes and dangerous roads in the dark with limited visibility. You, along with so many other of our frontline workers, continue to do your job in the midst of COVID, in the midst of a huge storm, keeping us safe and healthy and protected, and allowing us to continue to drive on through this year. So thank you very much for that. Thank you also to our entire set of frontline workers, continuing to see the pressure grow and build on you. I'm glad that some of our healthcare workers now, as we speak from Ulster County, are receiving COVID-19 vaccines, the Pfizer vaccine. So that is good news. We're going to continue to see that build and grow in the coming days and weeks. Next week, we'll be starting distribution to some of our long-term senior care facilities, both staff and residents, which is great news. And then as we shift into phase 2, probably in mid to late January, we'll be expanding even further. So the planning and the work continues on that. And so we will continue to press forward there towards that positive springtime where as hopefully the weather warms and clears, we'll also be able to get the vaccine out to everybody. I want to thank you all for tuning in for our update. Our next scheduled update will be Tuesday next week. We'll, of course, keep you updated in the meantime. If you have any needs, your loved ones or family or friends, please encourage them to call a recovery service center. Another group of dedicated public servants at the county that's been working through the storm. The volume of calls into our service center in the last few weeks has been growing as the needs are growing and COVID is resurging. And I want to thank them all also for their work. You can call them, you can reach them at 845-443-8888 or on our COVID portal, which has all of the data and updates, or shoot an email to RSC at our email address there. Also, thank you to Radio Kingston and our translation team for braving the dangerous conditions and the winter conditions to get here and get this message to you. No matter what's happening, we are here for you as a county government, as a team of people, as human beings that care about you, that know how much has been placed on each of your shoulders during this crisis, and we'll continue to do everything we can to support you in every way that we can. Thank you very much for tuning in. We'll see you in a few days. Stay safe and healthy, and let's remain resilient through this and stay warm out there.